and only local radio station for Bardstown and Nelson County. That's us, WBRT Radio, on 97.1 FM and still on 1320 AM.
We're still having fun, and you're still the one.
Well, good morning, everybody. Welcome in. It is time for Medica Pharmacy to bring you Medica Pharmacy and Wellness Center to bring you for your health. And with us this morning in studio on this rainy morning is Allison Schwartz. Good morning, Allison.
Good morning, Roth.
All righty. Well, it's as we said, it's a rainy morning here, and
fall got here, didn't it?
Finally, and now we want it to go away just as quickly as it arrived.
Yeah.
Today's topic is one that people need to listen up on because we always talk about what research is out there and having some knowledge of the things in the world of health to take care of ourselves. And today you've got a real interesting topic for us today.
It is. You know, I never have shied away from controversy because I figure controversy and debating is the only way you learn and you grow and you find the solutions to the problems that are out there. And I like to be a solutions-based person. So it is Breast Cancer Awareness Month.
Right.
And it's scary to know that if you develop breast cancer, your chance of surviving it is no better than it was 50, 60 years ago. There's just, as much as we've tried to, improve things and research it, your chance of survival is just not any better. And so you got to think of, why is it not any better? And are we not detecting it early enough? Is our way that we detect it not good enough? Or it really probably is not either of those. It's the fact that we are bombarded with so many toxins and chemicals that cause huge issues that all kinds of cancers are on the rise. The diet that we eat of, fast food, processed food, high sugary, processed, awful stuff, that contributes to it as well. I mean, when your body is deficient in certain vitamins, particularly your folic acids and your biotins, those are your anti-cancer vitamins. Vitamin D is an anti-cancer vitamin. So when you're deficient in nutrition, then your body can't fight off cancers like it should. And when you're eating these fast food meals, you're not getting those. And that's why one of the reasons we always push that a really good top quality multivitamin is essential, but you still have to focus on eating good foods. So that being said, we want to talk a little bit about breast cancer and, the ways that we detect it. Mm-hmm. The best way is self-breast exams. Mm-hmm. A woman knows her breasts better than anybody else. And I don't know how many of them out there really do their exams, but you guys need to be, really think of it as being at one with your breasts. And maybe that sounds corny, but you need to look at them. You need to feel them. You need to massage them. And actually, if you do it like a daily kind of massaging of the breast, you kind of increase blood flow, which helps to clean out your lymph system, which actually can reduce your risks of breast cancer. And there are certain essential oils that you can massage onto your breast to kind of help reduce chemicals and there's a long list of those, and that's nothing I would get into today, but if you want information on that, just come see me. But you've got to understand what's going on with your breast, and any changes are very, very important. And so, then they started going to mammograms years ago, and it was originally said that a mammogram would increase your lifespan by 1 year if you did have cancer. Now, if you really look at the research, what that you'll start to see is that typically mammograms would find that lump in your breast before you would by about a year. So technically, they don't really make you live longer. You just find that cancer a year before you would have found it on your own. So, then we need to think about, is mammogram the best way to go? There's also ultrasounds, and there's also something called thermograms out there that thermograms aren't as widely known. And even in the pharmacy, when I mentioned it, a lot of my staff and some of my pharmacists didn't know that a thermogram existed.
Yeah, when you mentioned that, the only words I could put with it was thermal imaging, which
right.
is used. You think about that now. The military has developed
right.
a lot of that. So I'm assuming that's kind of what it means. It's taking a look at some heat-producing parts of the body.
Exactly. So anytime you have cancer cells that are accelerated growth, anytime something's growing and changing, there's going to be heat around it. And so you've got cancer cells create their own food supply and their own blood supply, and so there's lots of things around there. And I'll admit I don't know a lot about the thermogram part of it, but I'm starting to see a lot of alternative medicine doctors and people that specialize in breast cancer are starting to go to that. Mammograms are really expensive, and from what we can find out right now, even if you don't have insurance, your thermogram is going to cost you about $195. Well, that's a heck of a lot better than the couple thousand I think the mammograms cost, and you don't have to go squish your breast between two plates and be all uncomfortable. It's a much easier process. So basically, if you're not sure what a mammogram is, it's an X-ray. Okay, it's an X-ray that looks to find those tumors that you can't yourself find. It uses an ionized radiation to create that image, similar to other X-rays. So they've been recommended for a while, and it used to be that women 50 and up were recommended to get them every year. Well, now they've said 40 and up. And then I read something not too long ago, and I'm not 100% sure if this is a true recommendation or if it's something they're thinking about or if there's just somebody threw this out there. But I read out there from one of the doctors that they're now saying that if you're high risk, or maybe you should have it twice a year. So, I know women that don't want to get a mammogram once a year because of the discomfort of it. So really twice a year seems a little extreme. So is it worth it? And I don't want to discourage anyone from preventing breast cancer. I want you to do your self-breast exams, but I want you to know there are options to mammograms. And I'm going to tell you what I've read is a little alarming, that there needs to be alternatives to mammograms. So back in 1995, which was, golly, as I told you earlier, almost 20 years ago, there's a medical journal called The Lancet. The Lancet is a very long-standing, well-trusted source of medical information. We used them in pharmacy school. The medical residents used them there to see all the different research data. Well, in 1995, they actually said about mammograms that the benefit of a mammogram was marginal, which means not very good. The harm caused from them could be substantial, and the cost was enormous. So I guess our question is, why are we pushing something that is marginally effective, harmful substantially, and very, very expensive? So, you ask, why is it marginal? Why is it not maybe the best option to prevent breast cancer? So there's a huge rate of false positives. And I personally know lots and lots of women who have gone in for a mammogram. They find something, they go in, they have to have a needle biopsy. So you get a needle, not a small needle either, a fairly large needle that's stuck down into your breast to find that lump that they found on the mammogram. And then they pull out the tissues out of your breast. And talk to the women that have had this done. It is not a good process. So you got to get these biopsies done. Well, they did a study on 60,000 women. Now, out of these 60,000 women, they found out that 70% of the tumors found on a mammogram were a false positive, meaning they were not cancerous. There wasn't even a tumor there a lot of the times. Well, that's kind of scary. So you got to think, you go in for a mammogram and you're like, oh, you know what? You've got a spot. We need to biopsy it. Think of the immediate stress response. And anytime you're under that kind of stress, you have a risk of getting ill. Just stress alone, as I've said before, is linked to the 6 leading causes of death. Short term maybe is not as big, but when you're under that much stress, it's kind of the equivalent of lots of little stresses all the time. So that's not a good thing. So, you get a biopsy, it's negative. Okay, well, so then it was an unnecessary biopsy because it was a false positive on the mammogram. So sometimes you're having those unnecessary and very invasive ones. So 70 to 80% of those all positive mammograms actually showed up to not be cancerous. That's a huge amount. And that's not a small study. 60,000 women, that's a pretty substantial study.
I would say that should give you some statistical margin of error. Should be pretty low.
Yeah, I can understand if there was 10 or 20 or 100 women, but 60,000 women, that's a pretty good sized group. So when you think about maybe the mammogram is false positive, but can it be harmful? Because they said it can be harmful. So, all right, how can it be harmful? When you do a mammogram, you're looking at 2 breasts. Most women have 2 breasts, not all, but some don't have one because of previous cancers or whatever, but most of us have 2. And so when you get a mammogram of both breasts, it is the equivalent radiation of 1,000 chest x-rays or spinal x-rays. Well, that seems to me to be an awful lot of x-rays, and we all know that x-rays are not good for us either. So potentially you shooting yourself full of that kind of radiation could potentially increase the risk of that a cell would turn into cancer, especially if you have other risk factors or other genes that can accelerate it. So that's a lot of radiation to think about. So there was a doctor, actually Russell Blaylock, that he says that he estimated that the annual mammogram increases the risk of breast cancer by 2% just because of that excess X-rays. The National Cancer Institute says that for younger women, it's especially dangerous. They said that in younger women, that mammograms could actually cause 75 cases of breast cancer for every 15 that it identifies. Well, that doesn't.
Did you say? Excuse me for interrupting. The National Cancer Institute.
National Cancer Institute.
Okay.
Yeah. So I mean, they're out there saying it too, and there's other studies that show that with younger women, there's about a 52% increased risk of breast cancer mortality in young women getting mammograms. So definitely the younger women, self-breast exams, look at a thermogram, maybe an ultrasound. Let's try to find an alternative for them. So there's also some rare forms of breast cancer. There's one that's a ductal carcinoma in situ, which is a breast cancer in that breast duct that are usually a little bit more aggressive. Apparently, since the dawn of mammography, that breast cancer has increased by 328%. Now, I don't know if that's because we didn't find it before or if the mammograms are actually increasing it because they are compressing the breast tissue. One of the studies I read is that because you compress that breast tissue on a mammogram, that if you do have cancerous cells there, that it can actually release those, and it increases your risks of having a metastatic cancer, which that, scares the bejesus out of anybody. I mean, it's bad enough to have cancer localized to a breast, but when you have it metastasized to liver, lymph nodes, wherever, I mean, we all know that that's a worst case scenario. There's rarely a gene, an oncogene, an AC breast cancer gene, and they say that 10,000 of those gene carriers will die because they actually have especially increased risks of breast cancer following a mammogram. So, I honestly don't know if there's a test for that, but it's one of those, if you do have that gene, definitely I think you would want to stay away from a mammogram according to what I'm reading. But the compression part is a concern. Anytime you damage tissue, especially with radiation, that's the breast cancer risk. So I don't want to, here we are in breast cancer awareness, and I know people are pushing mammogram. There's options out there, and you just got to wonder, is there an option that's better than a mammogram and safer than a mammogram? And we're actually trying to find out where locally we can get thermograms. I figure surely to goodness they're somewhere in Louisville, but because I was out of town, had a family emergency, some of my putting together this stuff was a little bit rushed, so I didn't get the areas, but I'm sure that you can find that out there. To, if you choose to do a thermogram instead of a mammogram, apparently they're quite a bit more reliable and a lot safer.
And of course, the ultrasound is something that's available, and I don't know whether they're referring to I'll call it a different type, but a different level of ultrasound. But I mean, I know that those are available in the doctor's offices much less.
Yeah, they're a lot easier. And there's a lot of insurances out there that won't pay for that ultrasound until you've had a mammogram. Well, mammograms are a lot more expensive, so if you have a high deductible, I mean, I know for me, if I had to go in and they said, well, you have to have a mammogram, and I'd probably say, no, I'll take a thermogram. I really would insist on a thermogram. But I know my insurance is one of those that won't pay for that ultrasound unless you've had a mammogram. Well, I have a high deductible. So I would just say, well, don't worry about it. Just give me the ultrasound because I'm going to pay less anyway.
Yeah.
So there's options out there. You have to keep in mind, ladies and gentlemen, men get breast cancer too. But, there's so much involved with the balance of hormones. I know that gets a lot of look at, and you got women, estrogen is bad, it causes cancer. Estrogen is bad, it causes cancer, but it's also essential to life. It's the balance of the hormones, and not just your estrogen and progesterone, ladies and gentlemen. It's the stress hormones, the growth hormones, you name it. I mean, you can't balance your hormones and expect you're not ever going to get sick. You've got to manage your stress. You can't live on processed foods and French fries. And I had somebody tell me the other day when I completely, I eat fairly healthy, and I told you guys last time that I completely changed my diet, and somebody's like, well, you're not eating anything good. I don't miss it. I mean, I feel so much better that I have no desire to go eat chocolate cake. Do I have a brownie every now and then? Absolutely. I read an article about how Oreos are more addictive to your brain than cocaine, and I'll be darned it, I wanted an Oreo.
Just by reading it. So
I bought some. I ate 2. It's fine. I'm good. I'm over the craving. But, so yeah, I mean, you eat that stuff every now and then, but the vast majority of what you're eating needs to be good foods. And you need to be aware of the chemicals that are increasing your risks of breast cancer. And if you don't get rid of those, then all of the screenings in the world aren't going to save you if you're not doing the right things.
Yeah. So as you always do, you're telling people it's our lifestyle that's so important, and then do some, again, the annual, what you say, not annual, but constant
the self-breast exams,
self-breast exams.
At least once a month, and they say the best time to do it is right after your menstrual cycle. But it's more of just feeling your breast. I mean, look at them in the mirror, put your hands on your hips, lift them up. I mean, because sometimes you miss something until you look at them from a different angle. Have your partner help you. Whether it be, boyfriend, whether you have a girlfriend, a husband, whatever. If you have a domestic partner, a loved one, whatever, that you sleep in the same bed with, have them help you, because, maybe they're not feeling your breasts as much as you are, but so they may notice something that's a little different. A lot of times if you're one of those that are constantly, what they call it breast fluffing to help prevent breast cancer, where you really massage your breasts and do all this other stuff. So maybe you wouldn't notice a change if you feel them every day, but maybe your partner who doesn't feel them every day might pick something out. But, get your loved ones involved, because you're going to need, if you do have something go wrong, you're going to need that support system, but they can help find those things for you as well.
Okay. And as always, consult your doctor.
Exactly.
And if you've got questions, consult your doctor and have them help you find the the
thermographies.
Thermography,
Yeah. Instead of
yeah.
a mammography, it's a thermography.
Yeah.
And the thing is that when you get that bad news, if you get it, is there's not just one way to treat breast cancer. You don't have to have chemo and radiation. There are alternatives. If you want to do chemo and radiation, that's great. If you don't want it, if you're one of those that you really want to go see if there's some kind of alternative, some natural, some acupuncture, some herb, whatever it is, and if your doctor really blows you off, find another doctor. If that's what you want, it's your choice, you have that choice, and you need to find whatever healthcare professional you're going to deal with in a situation like that needs to understand your life and your desires, and you have the right to choose your course of treatment. So find the options. And if you're with somebody who doesn't, and this is anything, not just breast cancer. I mean, this is, if you're wanting to lose weight, if your blood pressure's up and you have a doctor that's it's his way or her way or the highway, and they won't listen to you at all and work with you on making changes that you want to make, then find another healthcare professional. I mean, I talked about it with pharmacy, but the same goes with doctors and nurses. If you want to do something that's maybe not the latest, greatest thing by whatever drug rep that just came in the office, then it's time to get a second opinion. But it's, alternative medicine doctors are great. They're not always right. Traditional medicine doctors are great. They're not always right. But everybody needs to work together. So find somebody who's willing to listen to what you want to do and listen to your options. Because in essence, if you're under a treatment that you want to follow and you're positive about it, we all know that positivity and mindset has a lot to do with how you have your outcomes. So if you're behind the treatment and you want to do the treatment, you're probably going to be more successful.
Your stress level, even though it may be up because it's a treatment that you're going through, but your stress level will be down also.
Exactly. Yeah. I mean, you've got to feel good about whatever treatment choice you take. And it's so funny because you get family members involved and they think you need to do this way, this way, this way, and it's that way and everything. Honestly, what you want to do is what you need to do.
Yeah.
And, people can support you or not support you, but find the ones that support what you want to do and do what's best for you.
Okay. Well, a very interesting topic here during Breast Cancer Awareness Month, and tell us a little bit about what Medica Pharmacy and Wellness Center is doing during Breast Cancer Awareness Month.
Well, I don't know if you can see my shirt on the TV because I'm sitting, but we do have these little shirts that we designed for breast cancer. You can get them for $10. And every penny of that goes to the Flagey Cancer Center for their Yes Ma'am program. So we are supporting the mammography program out there to help prevent breast cancer. So we are giving every penny of those donations. So if you want a breast cancer T-shirt, stop in. We've got quite a few sizes in the office. So if you want a shirt, it's just $10. We're donating that away. And then a few of us are running in the Bourbon Chase, and we're hunkering down and getting ready for the end of college football season. We're not, it's just around the corner. So, but yeah, that's about it.
Okay.
Breast cancer awareness right now. The health fairs are all done, and we're still giving flu shots. My goodness. And I'm going to tell you that we're getting low on flu shots, and I've actually had a couple of pharmacists call me and say they are having trouble finding flu vaccine. Now, they assured us there was no shortage, and we think there's not really a shortage, but they are limiting what you can buy. So if you want a flu shot, you need to get it. If you don't want a flu shot, there's still the homeopathic remedy that works great, and we have some homeopathic flu treatments if you do get the flu that are safe for all ages to take. Okay. So, but do something. At least make sure you're sleeping well, eating well, getting your rest, and get out and get some fresh air,
Okay.
even in the rain.
In the rain, yeah. It's fresh. As a matter of fact, it may be even cleaner air.
And it looks like it's slowing down.
Yeah.
I think it's supposed to stop this evening.
Yeah. I was looking back at some of our previous shows earlier this morning, and last year at this time we did a show on sleep and how important that is.
It is, and it's a perfect time of the year to sleep because, golly, it's dark at 7 o'clock anymore. So, turn off your lights and go to bed. Get some rest.
Lower that stress.
Exactly.
Allison, thank you very much. Have a great, safe run during the Bourbon Chase as they come through our community tomorrow morning.
That's right. Look out for all the runners on the road between Jim Beam and Heaven Hill and out to Maker's Mark. So if you're out driving around on the Bourbon Trail at all tomorrow and Saturday, please be careful. Watch out for the runners. We will be running. I know I have a run that's at 3 in the morning, I think. I don't know, but we have flashing vests, but just be careful. Watch out for the runners. I did have a friend of mine that had to leap off the road last year to avoid getting hit. So
that's not a laughing matter.
It's not. So for you drivers out there that think us people that run are crazy, we are crazy, but at least keep an eye out for us and give us a little bit of space. We'd appreciate it.
All right. Thank you very much, Allison. We'll see you in a couple of weeks.
All right, sounds good.
That's For Your Health, a presentation of Medica Pharmacy and Wellness Center with 2 locations here in Bardstown, of course, and also in Shepherdsville. And we'll see you in a few weeks, and we'll see you on the road.
Yeah, I hope so.
Okay, that's our show today. It is 11:30 here at WBRT.
After 60 years of serving Central Kentucky farmers and outdoorsmen, offering Purina and locally mixed feeds, Tommy Hurst and his family at Bardstown Mills have expanded their operation into an impressive new 27,000 square foot retail center and warehouse at the corner of Kentucky 245 and Withrow